Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
It's Dr. Josh Luke here. Thanks for joining us for another episode of the Health Wealth Podcast and Radio Show with Dr. Josh Luke. This is episode 3 in the Health Wealth Basics series, a 6-part series that introduces you to the concept of health wealth. So let's start with the term health wealth as the first vocabulary word, if you will, that we're going to focus on. So episode 3 is about terms to know in health wealth. And that first term we're going to describe is what exactly is health wealth. Health-wealth.com is the website where you can find a lot of these tools and resources. But health wealth is simply the term for stating that you have personally determined that your company is spending way too much on wasteful healthcare spending, and you have made it a priority and a goal to reduce that wasteful spending on healthcare. And in the process, you're going to improve employee health. I previously have defined health wealth as the correlation between America's hyperinflating healthcare cost and the declining wealth of American businesses, but that's a little bit technical, isn't it? So I just like to describe it as really simply, health wealth is when you prioritize reducing wasteful healthcare spending within your organization or family and set yourself on a path to health wealth. So that's the first vocabulary word we're going to talk about today. And if you're this far in the Health Wealth Basics series, if you've already listened to episodes 1 and 2, then you're already familiar with the term consumerism or consumer-driven healthcare. Consumer-driven healthcare is actually essential. And in my book, Health Wealth, Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery, you're going to find 9 steps that companies can choose from on their path to health wealth. Sure, there might be a few more out there, but these are the ones that I've really seen working across the country. I actually didn't include consumer-driven healthcare as one of these terms, or one of these steps. Do you know why? Because you can't accomplish any of these goals without committing at the top levels of your organization to becoming a consumer-driven organization, meaning empowering your employees and giving them the resources to become engaged healthcare consumers, which is one of our next terms. So the next term after consumer-driven healthcare is EHC. Are you, as an individual, are your employees EHCs? EHC means engaged healthcare consumers. And just as we talked about consumer-driven healthcare being a necessity for your organization to achieve health wealth, the way your organization becomes a health wealth organization is by your individual employees making the decision to become EHCs, engaged healthcare consumers. And let me just really quickly explain what an EHC is. When you shop for a car or a house, you compare at length about price and quality in particular. Why haven't we ever done that with healthcare? Well, the short answer is, as Gen Xers and Boomers, we were always told, oh, don't worry about it, your insurance will pay for it. Well, when it's your own money, you behave a little differently, don't you? We have several episodes that are dedicated just to those concepts. You may have already listened to 1 or 2, but that's really what consumer-driven healthcare is about. Engaging in the process, number 1. Your employees becoming engaged healthcare consumers, or EHCs, number 2. And in order to do that, it takes us to our next term, which is a health wealth culture. Creating a health wealth culture is a necessity for any organization who starts down their path to health wealth, who makes it a priority and a goal and starts creating their plan. We have a bunch of tools available to you at health-wealth.com when you've made that decision for your organization to begin this journey. It's a not-for-profit website where you can order the book, you can take a loss assessment that shows you where you're vulnerable and shows you how much opportunity is likely for you to save. We have the 9 interactive steps to health wealth if you wanted to do the interactive steps as a team or as an individual in your organization. We also have Health Wealth Partners, which is where myself and a group of experts from all over the country that you'll meet on my podcast later will come out, and we will actually do a deeper dive on the loss assessment and help you really understand where your opportunities are. And a lot of those individuals are the ones who have already proven that they can bring that value to organizations throughout the country. I also frequently come out to your organization and speak or meet with the executive team. That's actually what I do for a living. I'm a professional public speaker, believe it or not. So I've been doing that for a few years and having great success. People tell me I'm funny and tell great stories when I'm up there. So I love doing it. So if they love hearing it, I'm going to keep doing it. So if your organization wants any of those resources or tools, they're available to you. Those tools and resources are part of your journey, just as understanding these health, wealth, basic terms are. So we talked about consumer-driven healthcare. We talked about becoming an engaged healthcare consumer. We talked about having a health, wealth culture, and a couple other terms you'll hear about as you venture on your journey into health, wealth, and read the book. You'll hear about full genome sequencing or partial genome sequencing. Here's what you need to know about that for now. That's DNA testing. You've heard about 23andMe. You've heard about DNA testing. There's much more to it than 23andMe. It goes a lot deeper. But really, that's what you're thinking here is do a DNA test, do a swab of your saliva, if you will, and we're going to tell you how you can benefit from that. And DNA testing is one of the things that might be a good example for our next term, which is the 3 Ps to health wealth. The 3 Ps to health wealth are having a plan. That plan is based on a preventative medicine plan and a personalized medicine plan for each individual employee. And I'm going to leave it at that because we have a whole podcast episode that digs a little deeper into that. But when you have that preventative plan and that personalized plan, full genome sequencing and DNA testing is part of that. Another term you'll hear is DPC, or direct primary care. That's a very technical one, so I'm going to leave that one a mystery for now and ask you to tune in to further podcasts to learn more. We'll have some experts like Mike Ochoa from Transcend Health on. We'll have Catherine Quinn on, who can talk about DPC, and also Dave Chase, who owns the Healthcare Rosetta not-for-profit, who has been involved with DPC for many years as well. You're going to hear a term, integrative medicine. What does that mean to you? Well, a lot of people might refer to it as naturopathic medicine. Many of us for years have known it more as Eastern medicine. And before you go, oh boy, Eastern medicine, here we go. It's actually one of the 9 steps is providing your employees as a retention bonus, as a 1 or 2 year reward for sticking with you. You'll pay as an employer for their integrative medicine consult. And what's happened in America in the last few years, and I won't go into too much detail, but basically integrative medicine has returned as a complement to Western medicine. So when you're doing both together, you're accomplishing a lot more. So these are some basic terms that you're going to want to know. And the last one is medical tourism. You may or may not have heard of medical tourism. You've maybe heard people, oh, I'm going to go to India and have a surgery, or Costa Rica and have a surgery. Or more likely, you may not have heard of somebody doing it, but you've had people call you and try to convince you to do it. And although we're not seeing a ton of that yet, it is happening, and it can save you thousands, literally $50,000 on a procedure as an employer if you do that. What we're seeing more of is local medical tourism, going from one county to the next to save significantly. So we'll dig a little deeper on that. So those are some terms that'll help get you started. I appreciate you coming this far on the Health Wealth Podcast and Radio Show to episode 3 of the Basic Series. I'm Dr. Josh Luke, and you can find me on LinkedIn at Dr. Josh Luke, or you can go to drjoshluke.com if you're interested in learning more about my speaking appearances and where you might see me speak. But you can learn all about all of these resources and tools we talked about at health-wealth.com. And the last thing I'll tell you before I sign off is Health Wealth is Healthcare Bankrupting Your Business book is available on Amazon as of January 2018. But in September of 2018, I'm going to release another book, and this name might sound familiar. Health Wealth is Healthcare Bankrupting Your Family. So I'm really excited that Health Wealth will come full circle as a brand during the year 2018, and I'm hopeful that this episode of Health Wealth Basic Terms will help you continue on your journey to reduce wasteful healthcare spending for your organization. It's Dr. Josh Luke with the Health Wealth Podcast and Radio Show. Thanks for joining me.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.